At night, you will not need to have your leg elevated. So you will not need the wedge or any other bolster that you've designed, but you will need to wear your knee immobilizer at night, all night, every night until the doctor tells you otherwise. This wide part goes at the top of your thigh, this narrow part down at your ankle, and this hard spine goes behind your knee. When you're putting these on, you're just going to take the straps from the bottom going up. It goes one strap from one side, the other to the other side, the entire way up your leg. These are meant to be snug. This is meant to immobilize your knee. However, if you have these so tight that it's pressing into your incision or into your drain site that's often very tender, or if you suddenly can't feel your toes anymore, then it's too tight and you can loosen up a strap or two. Just don't make it so loose that your leg is flopping around in there. When you have these on at nighttime, as I said, you do not need to be elevated, and you are actually allowed to sleep in any position that you want to. So if you're not a person that sleeps on your back, please don't feel that you have to stay on your back. You're allowed to sleep on your side, on your stomach, however you can get comfortable. If you're going to lay on your side, I would recommend that you put a pillow between your legs just for the sake of comfort. You may even want to have a couple pillows tucked behind your back so that you're not rolling out of this position all night long. When you wake up in the morning and you go to remove your knee immobilizer, I would also recommend that as you're taking these straps off, you reattach the straps to the side that they came from, simply so that the next night you're not digging around underneath that leg trying to figure out which strap came from which side. The other thing that you'll need to know about is the ice. You will all go home with at least one ice bag. If you've had one knee done, you get one of these black ice bags. And these hold 3 packs of ice. So when you've had a single joint done, you go home with one black bag and 6 packs of ice. So you can always have 3 on your knee and 3 in the freezer ready to go. When you've had both knees done, you'll go home with 2 black bags and 12 packs of ice. Again, always having ice on your knee. You cannot over ice your knee. It's going to help with your pain control and help with your swelling. And he always says if you're not frostbitten, you haven't overdone it. So please continue to use your ice as long as you can tolerate it. The last thing that we need to cover today is how to get safely in and out of the bathtub shower. You will need something to sit on while you're in the bathtub or the shower, regardless of whether it's a bathtub shower combination like this or just a shower stall. If you have a shower stall, I do not recommend that you sit on a built-in shower seat. Those are generally low and they're generally not very deep this way, and you end up kind of perched at the edge. So I do prefer that you have something separate to sit on for in the bathtub or the shower. There are 2 basic options available out there. This option is what we call a shower bench. It sits both inside and outside of the bathtub shower. The second option is what we call the shower seat, which is this, and this one sits entirely inside the shower. I'm going to show you how to get into the bathtub using both of these options. Please know that neither of these are covered by insurances of any kind. This is an out-of-pocket expense. I would prefer, if you don't already have something, that when you're here we can practice on both so you can see what you like better and we can get you whatever you need. All right. When you're using the bath bench, you'll back right up to that seat, lower yourself down gently, and then you can use the cane as a leg lifter to get your legs up and over the edge of the tub. You'll sit while you're showering, and when you're done, have somebody bring the cane back so you can get your legs back out. Get yourself squared back up on that chair again. While you're still sitting here, you're going to get as dry as you can be. I don't want your arms and hands wet trying to grab a hold of that walker. I don't want the rest of your body wet making puddles on the floor that you can slip and slide in. Get dried off, get your walker, and get yourself back to bed. The other option is the bath seat. This sits entirely inside the bathtub or shower. You'll do exactly the same thing, only in this instance, as I back up to the seat, I don't feel the seat behind me, I feel the bathtub behind me. I need to double check visually that I'm squared up on that seat, reach back, and lower myself down gently. Again, you'll use that cane as a leg lifter to get your leg up and over the edge of the bathtub. And again, you will sit the entire time you're showering. When you're done, get that cane back, get your legs back out of the tub, get yourself squared back up on that chair and dried off before you start to move again. For the first 2 weeks following your surgery, once you leave this facility, we do want you to stay in your home until your 2-week follow-up visit. During that first 2 weeks, make sure you're always using your walker every single time you get up. Do not stop using it until your surgeon has said it's okay to stop using it. Limit the amount of time that you're up to no more than 20 minutes at a time, getting up for your meals, for toileting, and once a day to either shower or sponge bathe. While you're home the first 2 weeks, visiting nurses should be coming into your house to take your blood levels and also to be looking at your incision. Physical therapy will also be coming into the home to help with your stretching and making sure that you're getting the range of motion that you're supposed to be getting. We also want to make sure that you're not doing stairs at home more than once a day if you've had a single joint done. And if you've had both knees done at the same time, we would prefer for you to stay on one level if at all possible. If you need to, you can always call the nurses station at the rehab unit. The phone number there is area code 814-333-5320. There is somebody working 24 hours a day. It does not matter what time of day or night you have a question. You call, you ask them. The nurses on that unit are excellent. They know the doctor's protocols inside and out. If it's something that they are not able to tell you immediately, they will get a hold of the doctor immediately so that he can get back to you. So do not hesitate to call if you have any questions at all.